We have a clinical example, fibromyalgia, female, 52 years. Okay, a woman came with pain in the neck and both shoulders and some wandering pains in the back, hips, and elbows. Her main problem was with the neck and shoulders. Pain was constant, somewhat better in the second half of the day. So that means towards the afternoon, evening, and in the warmer climate. Always worse during the early hours of the mornings. So she gets up from bed as she cannot lie anymore. Often she has an occipital headache on getting up, which works its way out in the afternoons. Her neck mobility is poor in the mornings, but improves as the day goes on. The above example is a typical case of fibromyalgia and damp wind pains. The patient was large in her upper body, had a swollen appearance in her neck and shoulders. Pressure on the painful areas hurt very much. So this is very excess. And she could not tolerate even a shoulder bag strap on her shoulders. Her face, hands, ankles, and feet also had slight edema. It was evident that the patient's biggest problem was with the dampness, which seemed to stagnate around her neck and shoulders, became worse after long hours of sleep because there was less functional qi to circulate the dampness, and the stiffness and pain improved after longer hours of movement. The warm weather helped but did not completely alleviate the pain, so it was not a cold pain. Where was the dampness originating from? Maybe she was eating too many milk products and refined carbohydrates and sweets. She needed to cut out fatty foods, milk products, and raw foods and refined starches. The organ that generates internal dampness is the spleen, and anything that slows down its function of circulation or that increases thick fluids in the body will also cause damp stagnation in the spleen. Having advised the patient about her diet, her dampness was treated with the following points: spleen 9, which is called the Lasix point; stomach 40, Luo point; bladder 20, Bakshu point, to improve the functional qi, and to descend and eliminate the dampness through urination. Many needles were given locally in the neck and the shoulders, followed by cupping massage to move the thick fluid around. After the first session, she mentioned that she felt lighter in this region and could move freely. After 10 weekly sessions, she was extremely well, most of her pains gone, even the ones in the rest of the body that she was not treated for. Do you think this result would have been possible if only her neck and shoulders were treated with local and distal points? So it is a good idea to treat the problem and the person, for which a case history and examination is very important. We practice energy balancing therapy. To do this successfully, we need a diagnosis of which imbalance is in which organ or meridian. So a good treatment follows a good diagnosis, and a good diagnosis follows a good consultation with the patient. Let us do it together.